Welcome to this resource on understanding Kawasaki disease. We'll have some helpful information for you that you might see on an exam, as well as practice questions at the end. For now, let me welcome you to Artemis Interactive Media. Artemis is your guide to learning resource supplements and content overview for continuing education. This quick timeout is a short study break and we'll cover understanding Kawasaki disease, but don't worry when we get to the questions if we need some guidance. Artemis will be here to help us. Kawasaki disease is also known as mucocutaneous lymph node syndrome. It's an inflammatory disease affecting the blood vessels. It usually occurs in children under 5, and the cause is not fully understood. It can affect the coronary arteries as well. Common signs and symptoms include a high fever lasting several days, red eyes without drainage, rash and swollen lymph nodes, strawberry tongue and cracked lips. You may also see swollen hands and feet. Treatment and nursing care includes IVIG, which helps reduce inflammation. Aspirin helps reduce clot risk. Monitor heart function carefully and encourage follow-up appointments. Here are some key takeaways. Early treatment improves outcomes. Cardiac complications are the biggest concern, and children usually recover well with treatment. So remember, Kawasaki disease can be difficult to understand because symptoms may be similar to other cardiac illnesses, and this disease affects more than just the heart. Also, we usually avoid aspirin administration to children due to the association with Reye's syndrome. However, we do give aspirin to children with Kawasaki disease. The aspirin offers an antipyretic as well as an antiplatelet effect. Children with Kawasaki disease may need moderate to high doses and may require additional anticoagulation therapy. So, before we test our knowledge, Kawasaki disease can be a complicated topic to understand, and this condition affects more than just the heart. So, symptoms may include findings that may seem unexpected for general cardiac issues. The following questions will test our knowledge on the material we covered in this resource. So, please answer the following 5 questions to gauge our mastery of the material, and don't worry if we need Artemis, she'll be here to guide us. Question 1. A nurse is caring for a child suspected of having Kawasaki disease. Which symptom is considered a hallmark finding of this disorder? A. Productive cough with wheezing. B. High fever lasting several days. C. Severe abdominal pain. Or D. Sudden weight gain. Artemis, can you help us out? She says B. High fever lasting several days. Can you give us some rationale? Persistent high fever is one of the primary signs of Kawasaki disease. Question 2. Kawasaki disease primarily affects which body system? A. The nervous system. B. Digestive system. C. Blood vessels and cardiovascular system. D. Respiratory system. I'm going to say C. Blood vessels and cardiovascular system. Artemis, are we right? And it's C. Can you give us some rationale? Kawasaki disease is an inflammatory disorder that affects blood vessels, especially the coronary arteries. Question 3. A nurse assessing a child with Kawasaki disease would expect which additional finding? A. Strawberry tongue. B. Bradycardia. C. Petechia on the lower legs only. D. Gray skin discoloration. Artemis is going to say A. Strawberry tongue. Can you give us some rationale? Strawberry tongue and cracked lips are classic findings associated with Kawasaki disease. Thanks, Artemis. Question 4. Which age group is most commonly affected by Kawasaki disease? A. Older adults over 65 years. B. Teenagers. C. Newborn infants only. Or D. Children under 5 years of age. I'm going to say D. Children under 5 years of age. Artemis, can you tell us if we're right? And we are. It's D. Can you give us some rationale? Kawasaki disease most commonly occurs in young children under age 5. Question 5. Which complication is the greatest concern in a child with Kawasaki disease? A. Kidney failure. B. Coronary artery damage. C. Liver cirrhosis. Or D. Hearing loss. I'm going to say B. Coronary artery damage. And Artemis says we're right. Can you give us some rationale? Kawasaki disease can cause inflammation of the coronary arteries, leading to serious cardiac complications. Thanks, Artemis. Thank you for your attention to this resource presented by Artemis Interactive Media. This presentation may be used for content review and clinical competencies for pre-conference and post-conference education. This quick timeout can also be used for a short study break. Kawasaki disease involves more than this QT covers. For more information on this disorder, please contact your instructor and refer to your textbook.